Sepsis, oftentimes we see it as a missed diagnosis following an abdominal surgery. Anytime somebody operates on your bowel, which is full of all kinds of nasty bacteria and bugs, one of the risks is that you get an infection and then you become septic. So anytime you have abdominal surgery, a physician following you after that surgery needs to be acutely aware of the signs and symptoms of sepsis, because you're already at risk. They've just cut on your bowel, and if that place they sewed back together doesn't hold, bacteria get out there. If you've had, let's say, diverticulitis, which is just pockets of your bowel that are become infected and inflamed, and those little pockets that stand out from your bowel, and if they rupture, they just release bowel contents into your body, feces, and guess what? Your body reacts and you develop SIRS, and they got to get in there and they got to fix it. And even if they've fixed that, guess what? For the next week, they should be watching you carefully to make sure that you don't become septic again. Post-operatively is one of the big times that you will see patients develop sepsis. But you can be working out, out on a farm or whatever, have a really bad cut, ignore it, and for whatever reason, that bacteria gets into your bloodstream and you develop SIRS, and suddenly you're sitting at home and you're panting and you've got a bad fever and your heart's racing. Well, you need to get into a doctor. And you show that doctor that festering cut, and they look at you and go, well, the heart rate's above 90, the respiratory rate's above 20, and he's got a fever of 102, and he's got a festering cut right there. It should be a pretty easy diagnosis. And unfortunately, though, sometimes medical care providers miss it.